Polycystic ovarian syndrome and its effect to the quality of life among millennials.
Good day, I am Catherine Ann Ibundako and I will be presenting to you the background of the study. Polycystic ovarian syndrome is a categorized endocrine disorder that primarily affects the ovary. In the latest survey, this disorder has been the topmost endocrine disorder across the globe that affects most women during the childbearing age or the millennial generation. Overproduction of androgens and ovarian dysfunction can lead to the development of polycystic ovarian syndrome that can happen in one of the ovary or worse, both. Women suffering from polycystic ovarian syndrome have ovaries that produce mildly elevated level of androgen that can cause the ovaries to stop producing mature follicles, which are small cystic incubators for developing eggs. Symptoms of PCOS such as acne, alopecia, hirsutism, infertility, irregular menstruation, obesity, skin tags are often linked to either an increase in androgen or insulin hormone levels. These symptoms were first collectively known as the Stein-Leventhal syndrome, until the induction of ultrasound aided doctors to easily diagnose polycystic ovaries. Afterwards, this syndrome was referred to as polycystic ovary syndrome or PCOS. Knowing the early signs and symptoms of this disorder and seek for immediate health care can help in avoiding complications in the body like lifetime infertility and surgical removal of ovaries. And now to proceed with the synthesis and gap analysis of the study. Elicited from the review of related literature that the researchers gathered related to polycystic ovarian syndrome and quality of life. It was found out that quality of life has four domain factors, which are physical health, psychological stage, level of independence, as well as personal beliefs in their relations with the environment. Similarly, some studies explore quality of life and how it was affected by means of health condition. There are some studies that present how polycystic ovary syndrome affects the quality of life and determine factors contributing to the effects of PCOS in the life of the respondents. Some studies have presented common symptoms of polycystic ovary syndromes, which are irregular periods, excess body hair, weight gain, acne or oily skin, infertility, depression or mood swings, and male pattern baldness or thinning hair. Moreover, the quality of life is affected when there is a domain of it that is affected by the health condition, environmental situation, psychological status, and social relationships. The researchers have explored many foreign studies and literature about polycystic ovarian syndrome and its effect to the quality of life. Though several studies have been conducted in different countries and states, no study have been published about polycystic ovarian syndrome and its effect to the quality of life focusing among millennials. Also, previous studies often look about the effect of polycystic ovarian syndrome and its effect to the quality of life of women in correlation to age, basal metabolic index, education, and marriage. But they did not look for its effect in the physical changes and mental challenges of the respondents. Thus, this present study aims to determine the effects of polycystic ovarian syndrome to the quality of life, focusing the two domains, which are the physical health and the psychological state among the millennial generation in the Pitan City, province of Zamboanga del Norte.
Good day, ma'am and sir. My name is Rowella Vidilasan from BSN 3, Block E, and today I'm going to explain the theory and the statement of the problem for our research proposal titled Polycystic Ovarian Syndrome and its Effect to the Quality of Life Among Millennials. So, theories. Theories. This study is anchored to the theory of quality of life by Maslow as cited by Soren 2003. Maslow based his theory for development towards happiness and true being on the concept of human needs. He described his approach as an existentialistic psychology of self-actualization, based on personal growth. When we take more responsibility for our own life, we take more of the good qualities that we have into use, and we become more free, powerful, happy, and healthy. Maslow's concept of self-actualization can play an important role in modern medicine, as most chronic diseases often do not disappear in spite of the best biomedical treatments. It might be the real change our patients have for betterment is understanding and living the noble path of personal development. The hidden potential for improving life really lies in helping the patient to acknowledge that his or her lust for life, his or her needs, and his or her wish to contribute is really deep down in human existence one and the same. But you will only find this hidden meaning of life if you scrutinize your own life and existence closely enough to come to your innermost self. So as for the theory, we use this theory because the focus of our study is how the PCOS affects the quality of life that the millennials or the young woman has. So, as a young woman, if you are diagnosed with PCOS, this could be a disturbance, especially on your psychological or your mental health. And with this theory, it is connected because as a person and as a woman, you connect or you live through your quality of life. If you are comfortable with your life or are you happy living your life. So if you are diagnosed with PCOS, this could become a barrier to have the quality of life that you really want. Statement of the problem. This study wants to investigate the impact of polycystic ovarian syndrome of specific respondents, which are the millennial generation. It also aims to examine how polycystic ovarian syndrome changes the quality living of millennial. Specifically, this study wants to answer the following questions. 1. What are the physical changes of the woman living with PCOS? 2. What are the mental changes that women with PCOS experience? 3. Is there a significant difference between physical changes to women diagnosed of PCOS? 4. Is there a significant difference between mental challenges to women diagnosed of PCOS? So for our statement of the problem, we want to answer what are the physical changes of women living with PCOS, because for some other women diagnosed with PCOS, they experience physical changes like too much hair growth on some areas. And for the mental changes, some women diagnosed with PCOS develop depression, anxiety, and other mental challenges. And we want to know if there is a significant difference between physical changes and two women diagnosed of PCOS. Do they have the same experience or do they have the same symptoms? As well as for the mental challenges that women with PCOS has.
Hypothesis. This study is based on the following premise. Hypothesis 1. There is no significant difference between physical changes to women diagnosed of PCOS. Hypothesis 2. There is no significant difference between mental challenges to women diagnosed of PCOS. Research methodology. Method used. The researchers will use quantitative research design with descriptive approach using survey methods, such as questionnaires with close-ended questions, to better understand the effect of polycystic ovarian syndrome in quality of life among millennials focusing on the changes in physical feature and mental challenges of the women living with PCOS.
For the respondents of the study, this study uses purposive sampling in determining and selecting the respondents, wherein the respondents must be millennial, where they are 26 to 42 years old or born on 1981 to 1996, and they must be diagnosed of polycystic ovarian syndrome. And also, second, this study uses quota sampling in getting the population, wherein 30 or more respondents would be enough for quantitative analysis for the data interpretation that we will be having for our respondents. For the statistical treatment, the researchers have used frequency count and percentage for the first questionnaire, where it is to be able to identify if there are physical changes in the body experienced by the respondents before and after diagnosis of PCOS. And for the second questionnaire, the researchers have used weighted mean in order to identify if there are mental challenges experienced by the respondents. And lastly, the chi-square probability, wherein the researchers will going to use it in order to determine and identify if there are significant difference of physical challenges to the women living of PCOS and difference between mental challenges experienced by women living with PCOS or diagnosed with polycystic ovarian syndrome.
Budget: Panelist 1,500, Critic 500, Statistician 500, Advisor 500, Tool and Questionnaire. To gather, obtained, and analyze data, the researchers made use of adapted PCOS questionnaire from the Polycystic Ovary Syndrome Quality of Life Scale. Development and preliminary validation. The questionnaire was carefully structured to gather data concisely and avoid confusion to the respondents. The questionnaire is divided into two parts. The first part is to gather physical changes of the respondents about the effect of polycystic ovarian syndrome in their body, that includes in status of menstrual cycle, with skin color, excess hair, acne, alopecia, and skin tags. Simple and easy words were therefore used so that respondents will easily understand and answer correctly. The second part of the questionnaire is to assess the mental challenges of the respondents.